What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering how physically demanding is the beloved field of radiology, the X-ray tech world. So to give you context, I am a night shift X-ray tech. Been doing it for about 4 years. Work ungodly amount of overtime. Like, there's been 3 to 4 months where I pick up like 26 nights, 25 nights. So I work a lot. As far as actual workload demanding, I could say if you are young and new to the profession and you're somewhat capable of decent shape, I would say, you should probably be okay. It is a more physically tasking job, especially the portable part of it. If you work in the emergency room like I do, and you do portable or mobile radiology, a majority of the times we just do chest x-rays, which are not bad. Most patients can lift up and you place the board, but it's when you get the super duper heavy patients that are dead weight in the ICU that you pick up the patient, you push the board underneath, so you could have maybe long-term have wrist problems. Or when you do hips and the patients can't lift up their hip and they are quite large, it does take a toll on your body. For anyone pursuing this career, I would recommend going to the gym, or at least whoever you work with, hope to God he's somewhat capable of somewhat strength, because there's been many times where I go in to help someone else and we're both like dudes go to the workout and like it'll be easy, like you won't even get tired. And then other times I'll go in and work with other techs who don't work out and are not, they're very, very skinny and not in shape, and it's like I feel more told the more taxed at the end of the night. Like it'll be more harder, my bones start to hurt, like you'll feel like more pain. So it is physically taxing a little bit on your, I'd recommend, because sometimes, especially if you work at night, majority of the times a lot of the nurses don't help you, and sometimes like you have to get the job done regardless of, there's the I can't do it because of the patient, or I physically can't get the job done. And I would say nothing more embarrassing than you physically can't get the job done, especially if like sometimes they'll intubate or they'll do whatever they're doing and then everyone else just leaves and it's just you to get the job done, and the doctors, they're waiting for you to get the picture. And it's rude. I'm not gonna lie, for anyone who's not capable of actually doing their job because they're physically not strong enough, like it is a little bit embarrassing, because like the doctor would be there, and some doctors are cool and they'll help you. Other ones will just stand there and watch you struggle, and because they're like, there's not my job. I did the procedure, I'm just here waiting to look at it. I never struggle with that, but I've seen other techs struggle with it, and they come back and they're all embarrassed to tell us their situation, what happens. So I'd recommend pumping some iron, getting some strength, do something. Even I can see like you struggling to maybe work more overtime as the older you get, because it is physically taxing. Like most of our techs who are veterans, who are joining like the 50 to 60 year old club, most of them, they won't pick up ever. Like occasionally they'll like pick up because they want to, or like, and we can see them struggling a little bit. So it is physically taxing, I would say. So maybe it's not as a young, I could see more people switching to other modalities because it is less physically taxing. Like I could see people doing ultrasound, or some people do like MRI, some people do CAT scan, which CAT scan, that one too, sometimes you have to also, there's been many times we have to help them too. So they're all physically taxing, I suppose, but at least with like CAT scan, As long as you can get them on the table, the machine does everything else. Like we'll position them, and compared to X-ray, where even if they're on your board, you still have to move them, and it gets a little bit more complicated. So, in summary, I would say that it is a little bit of it does make it easier if you join the profession young. You learn a bunch of things, and it is less text, less like it is easier to work a lot when you're young. And like, I mean, and I would once again highly recommend anyone joining our profession go do some kind of physical activity, because you need some level of strength. Because there's been a few times where certain techs will come in and they'll get hurt, and it's not even because like the patient hurt them, it's because like the way they went to move the patient or pull the board, they like pulled out their back, or they got hurt. Something like there's been many times I've seen that before, and it's never someone who's physically in shape and like decently working out. It's always the ones that never work out, don't do anything, very scrawny, and you're just like, I don't know if you're gonna make it. You might get hurt. You better be careful. But I mean, obviously, it's not like a requirement, but there is a certain level of physical that comes with our profession, because we are moving people who aren't always walkie-talkies. So yeah, it's been your boy Miguel. See ya on the